Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. Yesterday, my colleague, the MPP for London Fanshawe, and I wrote to the Minister about the ongoing funding challenges facing St. Joseph's Healthcare in London. Last week, Londoners watched as the political pressure and media attention around this funding shortfall forced the minister to finally take action on the unfunded mental health beds at the new forensic hospital in St. Thomas. But the problems and cuts have continued. Can the minister answer the question we posed in our letter about whether she has a plan to prevent other cuts to frontline health care in London?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Speaker, and thank you for the question, because I was very pleased that that we are ramping up the capacity at the new Regional Mental Health Centre, the Forensic Mental Health Centre in St. Thomas. Speaker, this is they had 80 beds before. The new facility has got 89 beds. That is often what happens when a new building is built, that it's built for future expansion, and that expansion happens over time. So we were planning to increase the funding, and we did in fact increase the funding so that more people could be served in that particular facility. That was the right thing to do. It was what was in the works anyway, and I think the people at St. Joe's, because I met with the CEO of St. Joe's in London, and we discussed this very issue. Speaker, I will look forward to the supplementary to talk about what more we're doing in St. Joe's.
Thank you. Supplementary, the member from London Fanshawe.
Speaker, because of this government's choices, St. Joe's is being forced to cut 3% of its budget this year. This has meant cuts to 23 positions, including 8 nurses, and the cuts may not be over yet. Our constituents are concerned, and they want to know that this minister isn't acting when political pressure mounts. Can the minister provide assurances to the people of London that patients' needs and not political interests are driving her funding decisions?
Thank you. Minister.
Well, thank you, Speaker. And as I said, I've met with the hospital CEO, Dr. Gillian Kernahan. We discussed what changes they are making. They have assured us that patient care will not suffer as a result of this. The member opposite knows that we are changing how we fund hospitals, and we are doing it so that hospitals get funded based on the number of patients they serve. We are bringing fairness to hospital funding. That means some hospitals are seeing an increase in their budgets, others are seeing more challenges. We are doing it in a responsible way, Speaker. The people of St. Joe's know exactly what's coming on that front, and they are, I think, doing a very good job managing the funding, given the changes in our healthcare system. More services are moving to the community.
Yes,
and the member opposite knows that, yes, some people are being replaced, Speaker. Others are being hired.
Thank you.
So this works both ways.
Good question.